So again, we're welcoming Dr. Duran, Medical Director of Southwest Center on Aging, presenting telemedicine and COVID-19 today. Thank you, Dr. Duran, for joining us.
Yeah.
If we have any questions, we will go ahead and have a question and answers at the end of the presentation. Dr. Duran will go through his presentation, and then we'll go ahead and open it up for any questions that you might have. Feel free to, during the presentation, if you'd like to type your questions in the chat feature, you're welcome to do so. If you're only joining us through phone, then you can, when we open up the question and answer, you can unmute yourself, or you can push *4 on your phone and then be able to unmute yourself and go ahead and ask your question. During the presentation, I went ahead and muted all video and audio from everybody else except our presenter. If you wouldn't mind leaving that, leaving yourself muted for the time being until you are participating in our question and answer part of the program. This will just prevent any interference such as background noise and that sort of stuff from interrupting the presentation. So thank you, Dr. Duran. Go ahead and get started.
Thank you very much. Thank you for having me, the Alzheimer Association. We really appreciate it. I think it has been very exciting times, regarding telemedicine. Telemedicine is something that we have, my practice has wanted to do for a long time, and for pretty much because of reimbursement issues has not been something that we have been pushed a lot. But regarding this COVID-19 outbreak, obviously Medicare and other insurances has given us an opening of potentially using telemedicine in a much broader spectrum. So I do wanna, my computer got freeze, so I'm gonna just go ahead and kind of go through the presentation. Meanwhile, we get you connected, if you don't mind, on the computer for the presentation.
Sounds good. I will go ahead and load your presentation as soon as I receive it. I haven't gotten it through my email yet, and then I will. Once I do, I'll share my screen, and we'll go ahead but you can go ahead and continue with your presentation, and we'll catch up.
Sounds good. Sorry about that. It just got freeze
Nope.
again. But so basically, what I wanted to do during this presentation is kind of talk a little bit about telemedicine, some of the benefits of telemedicine, some of the history of telemedicine. We'll talk a little bit about some of the new situation or new opportunities that we have with the COVID-19 pandemic, and of course we'll talk a little bit more about different types of telemedicine. Usually, telemedicine, by itself is defined as a remote delivery of healthcare services and clinical information using different telecommunications technology. These include a wide range array of clinical services through the internet, through wireless devices, and also through the satellite and telephone media. I think, when it comes to telemedicine, obviously this is an interactive, real-time technology, like, especially through video, where healthcare services are delivered directly to the patient. They usually, it could potentially be, obviously a telecommunications between the providers and patients, but also could be a digital transmission of clinical information, of images, and like potentially MRIs, or potentially what they have done before is like pathology reports. Telemedicine, obviously, we're hearing more, these days regarding the telemedicine, but this is something that has been there for a while as we're going to go through, especially in the teleradiology and telepathology that have been used, obviously, for many years. And now also, especially starting a couple of years ago, we have this technology where people can actually wear and have remote monitoring devices, at home, where they can potentially check vital signs like, your blood pressure, your glucose, your oxygen levels, your weight, your peak flow. where it could potentially be remotely taken at home and monitored on a different level, different level at the office. So all these are good examples of potentially telemedicine strategies or that potentially have been used in the past and lately have been used more.
Dr. Duran,
Uh,
I'm sorry to interrupt you. I do have your slides back up. I'm on slide, what is telemedicine? Is that where
yeah,
I should be, or would you like to direct me to?
let's go to.
I'm sorry?
Denise, I believe he got disconnected.
Okay. Sorry, just bear with us. um, Dr. Duran will join us in just 1 minute.
Sorry, everybody, we're having some technical difficulties, but in the meantime, when we got things up and running again, we do have some other presentations that will be coming up for the month of May.
Great point, Alexis. I'll go ahead and share. We have actually right now we have a calendar. It looks like Dr. Duran might be back with us. Great. Okay, good. Dr. Duran is back with us. So we will go ahead and share some additional presentations that we have coming up. We do, if anybody is ever interested in any additional education programs we have, if you want to go ahead and go to communityresourcefinder.org, clicking on Alzheimer's events, and you can always find any presentation that we have to offer. All of our presentations are free, so you'll be able to go ahead and see what might work for you. Dr. Duran, do we have you back? Oh, he's muted. You're muted, Dr.
Yeah,
Duran.
I'm
Okay,
good.
perfect, great. Okay.
So I'm sorry, guys, about this. So going back, I'm sorry about the presentation. So in the slide number 5, history of telemedicine, we, again, this is something that obviously this is not new. Since 1905, they were already transferring electrocardiograms electronically. And this is something that obviously, it have been, obviously started, since then, getting people to review EKGs, other facilities by other doctors. 1960s, obviously, introduced by NASA when they were able to monitor blood pressure, they were able to monitor heart rates, sugar levels to astronauts that they were when they were in space. 1990s really we started using a little more of telemedicine, and as I said, this is something that has been used obviously in the past when it comes to teleradiology practices, and pathology. Since I have been a resident or medical student, it's well known that most of the X-rays and especially when it comes to pathology, those lights they were sent to Mayo Clinic, they were sent to big institutions to be reviewed by other pathologists, and of course, when it came also for radiology, even now, even more, but a lot of the radiology images that we get today, they're not being read locally at a hospital. They're being read at an outside facility, maybe by another radiologist that is at home. So in the 2000s, telemedicine started kind of coming a little bit more. Medicare, again, every single, when it comes to potentially approve some services, I always said it comes especially when who's going to pay. Whenever Medicare, allowed the telemedicine, they said initially, okay, well, we'll approve the telemedicine, but it will need to be when the patient is in a Medicare, Medicaid facility approved, and there needs to be a certain provider, doctor, MD, nurse practitioner. They later develop, they approve for psychologists and especially like dietitians or social workers. But the key was that the patient needed to be in a what they call specific place, where he was Medicare approved, and that means like a nursing home, especially like a hospital, like a psychiatric hospital, or like some rural medical offices. So it was very limited. Obviously, it has been very limited. Something that we have tried to utilize, but it's become very challenging. At some point, we tried to utilize it as skilled nursing home or skilled facilities, but it requires infrastructure, it requires staff, it requires obviously technology. So it's obviously it was not easy, or it is not easy. However, obviously in March 6th, obviously unfortunately we got hit by coronavirus, and obviously as we have all lived, these changes in the way that we live. But one thing that they brought right away, they said, okay, why don't we just implement telemedicine to avoid people being exposed in medical offices, hospitals, avoid hospitalizations, avoid rehospitalizations, avoid ER visits, and bring the telemedicine back and allow people and doctors, providers to see patients at home. And that was, by President Trump, that was what he called the 1135 waiver of the Coronavirus Preparedness Act, and that kind of changed everything. And we'll talk a little bit more, but obviously now we have a room to see patients of telemedicine when patients are at home, and we're actually gave some room to also some different modalities. I think one of the things that I'm always has been very encouraged is that I always have said that the future of the future of medicine is geriatric medicine, because we're all getting older. For sure the number of aging population is drastically moving into a huge tsunami of people getting older than 65, especially with the baby boomers, getting 65 and older on a daily basis. But if I would say that it's something that is going to potentially change medicine in the present and the future, I always have said it, that it's going to be telemedicine. Telemedicine for sure is so convenient, when it comes to providing care, that it's so convenient, especially obviously for my population, for the older population, that they're not being able, the potential, the access to have your doctor, eventually in the palms of your hand, and being able to resolve, most of your problems, to be honest, through a communication. I think that's definitely something that is gonna revolutionize healthcare. So, when it comes, it's something that we have, going back to benefits of telemedicine, slide number 6, the reality, this is kind of a general view, but I think 78% of the ER visits, urgent cares, and potentially doctor visit patients can be handled safely and effectively over the phone. And I can tell you, based on my experience, my practice has been since March the 6th, we have been doing telemedicine. And I think, to my surprise, it has been several things have happened. It has been very well accepted. It has been people have enjoyed the interaction. I think they have noticed how easy it is and how convenient it is, for the fact that, especially for my population, that some of them, they're like homebound or they're bedbound, or they struggle to get transportation. Some of them you guys have heard that, some of the dial-a-ride transportation, they require like 2 weeks or even more to schedule an appointment. Sometimes, it requires for the daughter to be get out of work, so people, they can take mom or dad to the office. So, obviously has been very convenient and has allowed me to provide faster care. I'm not gonna say better, because I'm there, but sometimes as good as potentially a face-to-face visit, but for sure way much faster, much more convenient. And as you guys probably are aware, time here in some situation is critical. Why? Because he avoids visits to the ER, he avoids visits to the urgent care. I think, I don't know if you guys have heard, the hospitals are struggling right now with patients because nobody's going to the ER. And the number of patients being admitted to the hospital has decreased to 50%, at least here in Cruces. So obviously we have learned something, and I'm hoping that Medicare, kind of learns from this waiver that they have gave us, to say, hey, by the way, this something that we did that finally was approved by the Congress. Maybe this is something that we can definitely continue, because I'm pretty sure if somebody's doing some research, that I'm pretty sure somebody's following data, they will find out that the decrease of hospitalizations and the save of money with Medicare is going to be tremendous. So if we go to the next slide, and as I said, telemedicine deliver results, and some of the, telemedicine has been studied widely, by other institutions. Unfortunately, right now, because Medicare is not being paid by Medicare, it has not been widely used as it has been used right now. But, for some insurances, like I know United Healthcare, Blue Cross Blue Shield, they have the access to do telemedicine if you call through a doctor, through a nurse practitioner inside the insurance. You're not, you were not allowed to see your primary care doctor or to see your cardiologist or other specialist through telemedicine, but at least you had access to a nurse practitioner in case of emergencies. And sometimes, have been utilized a lot by like pediatrics, especially. But yeah, obviously have been widely studied, and especially at the VA. The VA is something that they have used telemedicine already for many years, and I think because of the capacity that they have been able to use and improve the benefit. The same goes for some universities, some academic institutions. But it comes, when it comes to the VA, they did a 50% reduction on heart failure. When they started doing telemedicine, they have great programs using remote monitoring, as we said before, where they not only they potentially have home health, sending a nurse, due to evaluation face to face, but also they do telemedicine through the doctors, and they do remote monitoring by monitoring your blood pressure, your weight. So obviously, huge reduction in heart failure readmissions. 35% decrease in ICU average length, and 30% fewer deaths. Because one other thing that it has been very used in telemedicine is the use of telemedicine inside the hospital. Let me give you an example that it is being used right now. unfortunately, because of the lack of or the lack of certain specialties, especially in small or rural hospitals, telemedicine has become like kind of a must, especially for some to created to triage certain patients of high risk. Let me give you an example, like neurology. Neurology is something that even now is being used through telemedicine here in Las Cruces, where patients are being screened early in the year after a stroke to decide if the patient is a candidate for a medication that destroy the blood clot. Sometimes those medications should be given in the first hour, and it is critical that we go through certain criteria to decide if the patient is eligible or not. And usually, with the help of a neurologist reviewing the clinical scenario, is as good as sometimes as seeing the patient physically to decide if the patient is a good candidate for this medication or not. And when it comes to reduction of ICU, for sure, when it comes to those situations, not only has decreased ICU average length or stay, but has decreased mortality or late effects of stroke tremendously. Again, 40% fewer hospital readmissions. Again, as we talked before, not only through the remote patient monitoring, like we said with the CHF, but also being able to have access to not only other vital signs, but also have access to nurses and doctors and clinical coordinators that they will, help you prevent from preventing rehospitalization. I know Presbyterian has a great program called Hospital at Home, and where they can potentially do a lot of stuff, that we potentially should otherwise be treated in the hospital, like, give some IV antibiotics, maybe provide some IV diuresis. But also, one of the major things of the program is that they have nurses and doctors, calling, on a daily basis almost, and monitoring these patients while they're at home. So some big examples of how telemedicine, has been revolutionized. This concept of hospital at home has been something that started at Johns Hopkins many years ago. They started with that idea, and I think this is something that now that we're getting more open to telemedicine today, I think this is something that we're definitely gonna see more. Especially when it comes to older adults, where we know that getting patients to the hospital may not have the same. May have, compared to staying at home through this program, may have not only the same outcomes, but we actually may even have better outcomes regarding, worsening dementia, regarding days of hospitalization or days being sick, or regarding recovery, or regarding functional status, that, you potentially can achieve better at home when you combine, the help with the nurses, the doctors, and physical therapists, social workers, etc. And yeah, so again, I think, and then last but not the least, is, as you said, the number of miles traveled, as we said before, I think, people have found it very convenient because you're at home and, you avoid, you don't need to travel. Fortunately here for Las Cruces, we're a small little town and people don't need to travel much, but go back to big cities, like Houston or, other places where it takes you, especially in rush hour, it'll take you an hour, 2 hours to get to your doctor. And, it is very convenient. I just before, let me give you an example. I just hang up before starting my presentation with somebody that did telemedicine yesterday with a neurologist from Mayo Clinic. Mayo Clinic, in Scottsdale, they were able to do their communication, their follow-up with their neurologist from Mayo Clinic yesterday. They're being here in Las Cruces, and from there to Mayo Clinic. So to be honest, this opens a wide whole spectrum of opportunities when it comes to specialties. Being able to have potentially evaluation or potentially a second opinion by somebody that is probably better trained or have more knowledge or more experience in certain medical problems that you will be able to reach through telemedicine and have a second opinion by somebody probably a little more familiarized with what your medical problem is. So we go to the next slide. Obviously one of the things that has created way more interest is just is what you guys, or potentially what you guys what you guys have in the power of your hand. I heard recently, and that's something that, it kind of got me there, is the fact that, the phone, we hate it and we love them, and the reality that, the phone or the smartphones have become, I heard it saying from somebody that I follow, is the remote control of your life. As much as we like it or hate it, it is true. The phones have become such a big part of our life, for good and for bad, that it is imperative that we enhance the use of our phones. Me, and it's probably, I'm 44, and I'm pretty sure people that are older than me, the transition that they have seen, from the computers, where we were, 20, 30 years ago, compared to having everything on the palm of your hand, is impressive. So obviously, utilizing, having that capacity, that has changed obviously tremendously telemedicine, because, before, we may think that, it was, we needed to have a computer, sometimes a special computer, sometimes a special program, to be able to communicate. And the reality right now, with with the iPhones and the iPads, the access to telemedicine is just so easy and convenient, that it can be done anywhere. Based on this slide, 60% of the consumers, they said that, will be willing to do telemedicine. I can tell you from the March that we started, I would say 60, I would bring it up to a 90 or even higher. Everybody has been okay. Of course, it's associated with the COVID-19 outbreak, and some people are afraid of going out of the house. They're afraid of being exposed. I get it. So maybe the percentage right now is higher because of that bias. But obviously, as I said, the people willing to do a telemedicine, is great. And, and I'm, me and my Tyson, my physician assistant, we have found that, the acceptance of telemedicine and the experience that they have had has been really good. I do want to be aware of some limitations, and let me give you examples. I have a couple of few patients that we have tried to do whatever we can on telemedicine visits, and as I said, there's a lot that we can do, but when it comes to physical examination, then we're limited, especially even right now when you're doing telemedicine through a facility or through a hospital, you can actually utilize equipment that you can that is through telemedicine. Let me give you an example, like a stethoscope. You can actually have a stethoscope that is that it potentially could be it could be put on the patient's chest, and I potentially can hear those heart sounds in the comfort of my home. And there are little cameras, the little microscopes that potentially can be utilized as different modalities or ancillary services that they can be used to complement a telemedicine visit, and to complement the lack of face-to-face and physical examination. However, this is only on certain facilities and with the right equipment, not obviously through a mobile device. But yeah, I would say that, again, going back, there's certain times that, obviously a physical exam, is needed, and it cannot be replaced for a face-to-face evaluation. And but especially right now with the outbreak, it has tremendously been a help, for patients, providers, and for family members. Some, 15 million number of consumers, 2015, obviously the numbers that we see right now, they're going to change tremendously because of the use of telemedicine now. And, and as we said, I think as we go through, primary care has been utilized more telemedicine before, because other insurances before this, they were already paying, especially with not Medicare, but other insurances, commercial insurances, they're already reimbursement for telemedicine visits. So, it has been more utilized, as a family practice for younger population, for children, where they didn't use Medicare, since Medicare were not paying for telemedicine visit up to now. If we go to the next slide, Obviously, I wanted to go back a little bit to what we said, March 6, 2020, I'm sorry. President Trump signed an 1135 waiver. And what it is that Medicare can pay for office hospitals and other visits furnished via telehealth across the country, and including patients in places of residency, I'm sorry, starting March the 6th. It was allowed to be done by doctors, nurse practitioners, clinical psychologists, and licensed clinical social workers. So obviously, as I said, that kind of changed perspective, because the moment that they allowed us to see patients when being at home, obviously that changed the whole perspective. And also, what it changed too, if we go to the next slide, we changed the fact that they allowed us to have a waiver also on the HIPAA, that is the Health Insurance Portability and Accountability Act, that actually only allowed telemedicine through telehealth communication system that it was HIPAA compliant, meaning that it was certain technology and filters to prevent from being hacked by other people. That gave us a little bit of room, because they did. The Office of Civil Rights has issued a guidance of empower the healthcare providers to serve patients through other technologies or remote communication technologies, such as FaceTime, Facebook Messenger, Google Docs, Zoom, Skype, and that has allowed obviously to have better access to patients and more convenient. Because before, some of these programs, they were needed to be downloaded. You need to download an app, and then, so it requires some computer wisdom there to be able to, download the app and be able to handle, how the visit was going to be made. Right now, with these modalities that a lot of people are already familiarized, they use it sometimes on a daily basis to communicate with the family members, friends, work, obviously has created much, a modality that it has been way more easy and comfortable for patients to use. So if we go to the next slide, the other thing that just happened, just 2 weeks ago was major, is that, when it comes to Medicare telehealth visits, obviously it's a visit that is in which the provider uses a telecommunication system between the provider and the patient. However, it was the way that it was described, it was that needed to be a video audio communication for Medicare to potentially paid for the telehealth visit. One thing that we struggle, being me as a geriatric, as a elder, seeing patients of older adults, is that, not all my patients are very computer savvy. And some of these technologies are very easy to use. You basically send a message, they click the message, the screen opens, the camera opens, and voila, I'm there. So it's not that complicated. However, I do understand for certain people, especially if you don't have a smartphone, or, if you're not very computer savvy, even that could be a little bit complicated. So we found out that a lot of the patients that we were seeing through telemedicine, we were not able to do a video audio communication, that we were just actually calling the patients. And for that, Medicare was reimbursing as a different level, compared to what we're doing from telemedicine. That is the same reimbursement that you have from a face-to-face visit, starting this 1135 waiver, as we said. Well, 2 weeks ago, 2 weeks ago, more or less, they decided, Medicare allows that, audio visit should be paid the same way like a video audio visit. And that, even changed even more, to be honest. I think they have, that's another, obviously, maneuver that Medicare is doing, I guess, strategy that Medicare is doing to provide this care to patients and to allow access to doctors and other specialties, and understanding that these patients, some of them, they don't have the knowledge of the computer, and potentially may not have the equipment or, a smartphone to do this telecommunications. So I think that was tremendously helpful. I think patients, we have been able to provide these audio visits, in a more complex way, and I found it has been very convenient. Obviously, you have another limitation because, with the camera, sometimes even at home, I have been able to see the patient. I see their color, their breathing, their walking, their skin. I have been able to see wounds. So obviously a camera, obviously gives you that extra help. So, but again, by a simple phone call, there's also a lot of things that can be solved, it can be treated, through an audio visit only. Other visits that are being paid by Medicare is the virtual check-in, and pretty much this is a quick little phone call, usually done through a phone or other device, where you basically just make a quick little phone call, and usually this phone call, it will be something that it will be before or after a visit, where you want to specify or complement your visit from a previous visit. And finally, the e-visits. The e-visits are not being utilized a lot because it's something that is being done through a patient portal, and not everybody has patient portal, and not all the patient portals have the capacity to do these e-visits. My practice have a patient portal, and I can tell you we don't have the capacity to do audio e-visits, but we can do email, and we have done that. We have done that where people actually send me emails, and as you can probably would say, an email sometimes it could be as needed, as much as I need for somebody to give me an update on how they're feeling, how their cough, or how's their blood pressure, how's their sugars. So as minimal as that, that has been very helpful on having that access to the email and the e-visits through that. And we were doing it before, don't get me wrong. We were doing it, it was not getting paid by Medicare, and then starting obviously March 6th, even those emails were starting to get paid with the right documentation, with the right information. They're starting to be paid by Medicare. So we go to the next one, and we have kind of talked a little bit already a lot about this. Obviously for the consumers, it's ease, it's comfort, it's time saving. As I said, is something that it was needed, especially because people have access to their own primary care doctors. And don't get me wrong, this is not just for primary care. Obviously, being primary care, the main base for this. But I know that right now people have been able to talk to their or do a telemedicine visit with their cardiologist, with any other specialty. Obviously for us as care providers, I think we have definitely, having access to telemedicine is going to improve the quality of care. Regardless if I see a patient through telemedicine today, or do a face-to-face or doing a face-to-face today, I think that having the access to have a face-to-face allows me to see the patient and a follow-up matters. Let me give you an example. I see a patient today with a fluid overload. Maybe his heart is kind of failing. They struggled to come. Finally, the doctor was able to miss work to bring him to my office. Critical that I see him, critical that I examine him. But, I would say, it would be nice to see you back in a week. I definitely would like to see how your fluid, how your weight is doing, how you're feeling. And sometimes, it's hard for the family members to bring them back. But having access to telemedicine and being able to do that visit, on a faster and more efficient way, that's gonna bring, again, that's gonna prevent rehospitalizations, and it's gonna prevent ER visits. I can tell you that, I've been able to, through telemedicine, to be able to follow up, a little more closely my patients, and with great outcomes, and not only great outcomes on their clinical care, but great outcomes on their they're being happy with the service and happy with their health. Again, as I said, employees have been using telemedicine before in association with health insurances, or potentially with other companies that have provide telemedicine. So basically, an employee hires a company that do telemedicine. The employers hire the company. So employees are they have the access to talk to a doctor if they need to, and obviously that has has decreased the time away from work. That is has been obviously eventually compromised their economy and the economy of the company. And and again, healthcare system. I think this is efficient. It's modern medicine. Is the medicine that we should be doing now. As I said, I'm really hopeful that Medicare see all the benefits, see all the decrease on the rehospitalization and ER visits, decrease all the saving in money, and they keep this, to continue this in the years to come. I think that telemedicine has been exceptional for patients, for us, for doctors, and is modern medicine. Is medicine 2020, and it should be here to stay. Again, if we go to the next slide, again, we thought that the supersonic was something that when I was little, that it was something in the future, something that we were not going to see. But if you see now, I'm sorry that it's in Spanish, but we know we do the telemedicine. I know that, people are doing exercise online. We're working at home. We're video chatting with family members, with friends. We're doing meetings. We're doing parties, Zoom parties, and obviously we're shopping at home. So we go to the next slide. I will definitely would like to thank the Alzheimer's Association. Thank you guys very much for your attention. Happy to answer any questions.
Great. Thank you, Dr. Duran. Let me go ahead and see if we have any in our chat room, and then if not, I will open it up. We did have and I just want to read it because just to kind of recap, it looks like you answered it through the presentation, but one question addressed, does it have to be a video visit for reimbursement from Medicare? Is telephone okay? Many elderly do not know how to work, do not know how to video on computers. But then she said, never mind, you did answer that. But if you want to just kind of recap that it is, Medicare is available reimbursement through telephone as well, right?
That is correct. And, this just happened just 2 weeks ago when Medicare, give the green light about being able to pay through audio visit only. And as I said, that has been very convenient for my patients, just for the fact that, sometimes they don't have the technology, or they don't have they're not very familiarized with computers. So yeah, it has been very helpful. And we have been using it for the last 2 weeks, and Medicare reimburse same way as they reimburse telemedicine visits, same way as they reimburse face-to-face visit for now.
Great, thank you. Thank you, Dr. Duran. So also, I actually personally have a question, being that we do have probably many caregivers on our call here. There has been some issues maybe, or maybe you can let us know if there has been any issues with individuals that might have some cognitive impairment or decline who actually utilize telemedicine. And right now, being that some individuals might be, in a facility without their care partners that usually help them with this sort of thing, how are we navigating through that with telemedicine and individuals who might have dementia disease or even cognitive impairments?
Great question. And obviously is more challenging, obviously. I think the challenge is, for telemedicine, the critical part, even though regarding the critical part, regardless if it's telemedicine or face-to-face with somebody with advanced dementia, is obviously having, a caregiver, the son, the daughter, who really can help us provide more history, on behalf of the patient. So the same way that, if I would see a patient in my office with advanced dementia or in a facility with advanced dementia, we need the help of their caregivers. We need the help of the family members. So I can tell you in my experience, for patients that we have seen through telemedicine, even at home or at the facilities, we have been able to communicate with the caregivers or the family, and they have been our source of communication and information. I think when we have a camera, obviously most of the information is being provided by the caregiver or the daughter. But just having the access to the camera, not only I can see the patient, they can share some easy questions, yes, no, or potentially providing their pain. But again, the fact that you have a camera, I have been able to see, wounds, respiration patterns, et cetera, et cetera. So yeah, I think, we have done a few in the assisted living where caregivers have been very, very helpful on helping us complete telemedicine visit.
Great. Thank you, Dr. Duran. Anybody who is, we have another question in the chat room. Are care providers concerned that Medicare will reverse these waivers once restrictions are lifted?
Yes, very concerned, to be honest, because I do understand that they're doing this as an emergency due to the COVID-19, and the main reason that they did it was to prevent from people being exposed to COVID-19. So I do understand where that is coming and why did they kind of suddenly give the waiver and agree to all this. I know what the intention was, but I'm hoping that as they see it through the next few months, they realize that actually how helpful and how much money they can save through telemedicine. However, we always are in the fear that they don't do that and they cut us. Eventually. My understanding is Medicare has agreed to continue telemedicine at this level with this reimbursement for the rest of the year. I do understand that maybe if whenever it does change, I'm hoping that it's not cut back, it's not like completely off, but they'll do some adjustment. I know there will be some adjustments. I know that maybe the audio visit thing is not gonna get paid like a regular visit right now, but I'm hoping that they do preserve it to some degree, maybe with some more. I'm pretty sure there are gonna be more restrictions when it comes to the type of audio, the type of video, the HIPAA compliant, that we talked about, but they keep it some way, somehow.
Great. Thank you, Dr. Duran. If there are any more questions, if you are not able to utilize the chat and you'd like to go ahead and ask Dr. Duran a question, you're welcome to unmute yourself and do that at this time. Otherwise, we'll give a few minutes to see if anybody has any questions. And then I thank you, Dr. Duran, for all of this information. It's a very good understanding of telemedicine, especially with current times. This is very important for us to be able to continue that health care for us and our loved ones. So I do appreciate you educating on this topic for us today. Are there any questions for Dr. Duran? Alexis wants to say this was very informational. Thank you, Dr. Duran. So I am going to go ahead and say that we're right on time with our hour-long presentation. I do want to go ahead and Emily also says thank you, Dr. Duran. I do want to let you guys know I did go ahead and share a link in the chat, and
thank you.
Again, another thank you. And I do want to go ahead and share that we have some additional programs coming up similar to this information that Dr. Duran and other presentations surrounding important topics for caregivers. Next week, we have a Skills for Dementia Caregiving webinar coming up starting on the 12th. And then we also have Legal Roadmap, Planning Ahead for Dementia Caregivers. And then we also have a great presentation or a series of presentations that I posted the link for, and it's Know the 10 Signs and other presentations that could be really, really useful. And so we have a whole calendar going from now for the rest of the month, and then we'll have another one coming out in May. And so there's many different presentations that you can receive surrounding understanding Alzheimer's and dementia disease, and that also involve caregiving. So if you're interested in that, feel free to reach out to us. Our 1-800 number, you can register there, 1-800-272-3900. That helpline is actually available 24/7 for any issues that you might have surrounding caregiving or Alzheimer's and dementia disease. All right, Dr. Duran, again, we are really, really grateful for you today. Thank you so much for presenting for us and sharing this information.
No, thank you very much. I appreciate it. Anything that I can help, and I do apologize about the video and about the audio.
Yeah, well, it's to be expected, and all the technology, different platforms. Sometimes they work, sometimes they don't. We just have to be patient with each other. So I appreciate it. I think it went well.
Thank you very much. Have a good day, guys.
Bye-bye.